we reached our fourth annual International Sports Pharmacy Symposium. We will continue with Colin Ryan from Ireland. He will present us his again own experiences as a locum pharmacist, support pharmacist, and guest lecturer at the Royal College of Surgeons with the title of Expectations of the Athletes from the Sports Pharmacist, because he is very active in this sports field also.
Happy, great to be here.
All right, all right. Welcome again, and we want to please introduce yourself, and if you are ready, you can start your presentation.
Sure, sounds good. Yeah, so thank you very much, Summer, for having me here today and for all the work that you have put into this and behind the scenes as well. Yeah, I guess firstly, it's very important to point out that the level of kind of effort and dedication that you put into the group and that Athena and all of the team put into the US Sports Pharmacy Group is absolutely vital. And you know, even since I've started getting involved in sports pharmacy over the last number of years, it has kind of gone from strength to strength. So yeah, hopefully that will continue over the next few years, and I have no doubt with the involved that it certainly will. So my name is Colin Ryan. I am from Ireland originally. I'm over in Bermuda at the moment. I'm based between the UK and Ireland and Bermuda, and I'm going to speak today on the expectations of athletes from their sports pharmacist. A brief bit of background for myself first. So I'm from a tiny town on the west coast of Ireland, very rural, not a huge amount going on, but sport has always been a huge part of the community and the social structure over there. So I played soccer at a semi-professional level in Ireland till I was 19 or 20, then moved to Dublin to study pharmacy at the Royal College of Surgeons in Ireland. And in my 20s, started playing Gaelic football, which is a crazy mix of rugby and soccer and some handball thrown in there. I guess it was during this period when I was working in the pharmacy and playing sport at, I suppose, a national level, that the discrepancy between how medication is treated in the dispensary and how it is treated in the dressing room became very obvious and apparent to me. Mark touched on that in the presentation recently. There was a real, very lax attitude towards it in some of the dressing rooms I was involved in, and it raised a red flag. At that point, I wasn't too sure what role or what influence I could play in sports pharmacy. Moved to Bermuda in 2016, and I saw the International Olympic Committee Drugs and Sport course shortly after that. So I completed that course and have worked with the Bermuda Olympic Association, the Bermuda Football Association, and the Bermuda Olympic Athlete Commission to ensure that systems and policies and procedures are in place to make sure that medication is being used in a safe, appropriate manner by athletes and by organizations. What we're going to discuss today is the expectations around sports pharmacists and the expectations that both athletes and that sporting organizations do have and should have for sports pharmacists. So with this, we're going to look at medical ethics as the framework or the grounding for our role within sports pharmacy. The four pillars being beneficence, or the concept of doing good, non-maleficence, or doing no harm, autonomy, and justice. So I think it's important to take a step back and realize why we're all involved in sports pharmacy. We're obviously all passionate about pharmacy and passionate about sports. To me, the WHO definition of health being a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, is a very important one. Sport on an individual level is good for each of these different pillars of health, the physical side, the mental side, and the social side. But it's also hugely important, not just for the individual, but for a community and for a society as well. However, as we've seen before from our previous presentations, There can be issues where the worlds of sport and medication collide. Those potential problems include doping, adverse drug reaction, and suboptimal performance for athletes. So the definition that we had earlier of sports pharmacy is incredibly helpful and allows us to explain exactly what we do to other healthcare professionals and to athletes. As sports pharmacy is still relatively lesser known, people often ask me what exactly it is I do when I work with sports teams or sporting individuals. I find that sometimes it could be quite abstract trying to explain it or to give a definition. So I do find that storytelling or putting a little bit of background to it and a narrative helps to explain that. So Donald Miller is a storyteller, an author, and a branding guru, and he is a general concept that every good story has a hero. That hero has a problem. They encounter a guide who gives them a solution. There's a call to action, and they find their happy ending. So this applies to pretty much every story out there. I realize it's a pretty international audience today, so Harry Potter was about as international as I could think of. So you have Harry, he's our hero. Voldemort is the problem. He wants to take over the world. Dumbledore is the guide who gives the solution of the Horcruxes, gives Harry the call to action, and Harry reaches his happy ending. In the same way, when I'm speaking to athletes or sporting organizations, I try to explain it that sports pharmacists can be that guide for the athlete and for the organization. So we have the athlete here as our hero, the potential problems that we mentioned, doping, adverse drug reactions, and suboptimal performance. You can act as the guide with sports pharmacy as the solution. You give the information and the call to action to the athlete, and hopefully they can reach their sporting targets and goals safely. In terms of doping, this is one that's been touched on already, but advert and inadvertent doping can have huge implications for athletes, both on their health, on their career and reputation, and there can be a financial impact as well. Just in the last couple of weeks, we've seen that the Polish tennis player Iga, and I'm going to butcher this pronunciation, I'm sure, Iga Świątek was found to have given an adverse analytical finding or a positive test for melatonin that she had taken, which was contaminated with a banned substance. For Ms. Świątek, she was given a 1-month ban where she was unable to compete for that period. She put forward her defense, had been prescribed melatonin by a sports medicine doctor, and she had taken it in good faith, but unfortunately it was contaminated. It wasn't a medical grade or prescription only product that she took. It was a supplement. So this goes to highlight a point that Mark raised earlier about the potential for contamination and the need to be extremely careful with what an athlete puts into their body. Here, in terms of the ethics pillars that we're looking at, we have a responsibility and we have the ability to help athletes make good decisions around the medication that they use and the substances they put into their body. We can effectively assist them to do good. The melatonin is a legitimate medical product. It has a good evidence base behind it, but we can give advice and information. We can guide that athlete around how to source it safely and in a responsible manner. Adverse drug reactions is defined as the response to a drug which is noxious and unintended, so negative health impacts can be found again, can lead to player unavailability, health issues, can leave an organization exposed to legal action, and again can lead to reputational damage both for the athlete and for the organization involved. Daniel Agger was a professional football player who played for Liverpool in the UK. He represented his country on 75 occasions. During a preseason game, he suffered an injury and started using NSAIDs, non-steroidal anti-inflammatories, to treat the injury. Unfortunately, he found that he continued to need more and more of this medication to get an adequate response for his pain. And it got to the point where he was taking many times over the recommended daily allowance for the medication. It ended up where he played his final professional game. He had taken a large dose of anti-inflammatories beforehand. He was disorientated, he was dizzy, completely out of sync with what was happening on the field of play, and had to be withdrawn for his own safety and for the safety of other players on the day after just 29 minutes. So again, as a pharmacist and a sports pharmacist, we have the responsibility to do no harm. If sports pharmacists are involved in a group decision, we can make sure that athletes are using medication to a safe level and not over prescribing for themselves. So again, it was mentioned earlier by Athena, the importance of multidisciplinary teams, and it's very important for pharmacists to be involved in these discussions because we are the experts on medication and we can provide a real tangible benefit for athletes and for organizations. Then the last set of problems would be suboptimal performance. This is one that I've encountered a couple of times working with Olympic athletes in Bermuda. A very basic one where we have a number of athletes who are suffering from asthma. And in consultation with them, we did a medicines use review to see how they were using the medication and if it was working for them effectively. Now, these are athletes who have competed at Commonwealth Games, Olympic Games, but unfortunately, their inhaler technique was very, very poor. So again, they weren't getting the effective response from the medication that they were using. And as a result of this, it was having a negative impact on their performance. So again, pharmacists can step in at this point, provide some very basic education and training, and assist athletes to reach their optimal performance. So in summary, what we're looking at in terms of what athletes expect from us and what organizations expect from us, they expect us to be expert in medication. We've all trained and studied for a long number of years to become pharmacists. But on top of that, we do need to be educated in sports pharmacy. That's been touched on a number of times today about the potential routes to go down for that. The IOC Drugs and Sport course is an excellent one and one that gives a very solid grounding in sports pharmacy. There are a number of universities internationally, in the US, in Turkey, and other countries that have sports pharmacy courses at the moment. I'm currently lecturing in RCSI in Dublin on sports pharmacy to doctors, pharmacy students, and to physiotherapists. And again, it's very important that we collaborate with our healthcare professional colleagues to make sure they realize the importance of appropriate use of medication in sport and how sports pharmacists can provide a real tangible benefit to them. And finally, staying up to date is massively important. So there is new information coming out all the time, being aware of current affairs like the Iga Swiatek case and being aware of the implications and any follow-on questions that athletes may have from that is very, very important. So for the ethical side, again, we want to live up to the pillars and to do good, to do no harm, to ensure the patient has autonomy. So again, education is such an important part of this to make sure that they are fully informed about the therapies and medications they are taking or should not be taking in some cases. And finally, the pillar of justice, as we mentioned already, about the importance of acting within one's scope of competencies. So it's very important that you know where to draw the line and to refer to somebody else, and again, to work within a multidisciplinary team at that point to ensure that the athlete has the best possible care. Thank you very much for listening, and I am contactable at the following address if you need me.
All right, Colin, thank you so much. And by the way, before asking a question, your presentation technique was highly remarkable and innovative. Without sharing your screen, what did you use for this?
It's an app. It's an app called Prezi, Prezi, and you can transfer slides from PowerPoint into it and cut and paste between the two.
Very well, very well. So I will try this. I will try this. Thank you. So I have a question. Maybe while I'm asking, the participants will also write and ask. Did you, as a former player, did you take any advantage of your being a player while consulting to athletes? I believe that you have lots of experiences about this. Did you take any advantage of this?
Do you mean in terms of taking medication myself or working with teams while I was involved?
While consulting to any athlete, so I believe that your previous experiences in sports field will help your medical consulting.
I understand. Yeah. Yes, I think it's been a massive addition where I suppose I have maybe firsthand knowledge of how medications are treated in the dressing room. And by some athletes, there were a couple of cases that stand out in my mind where, again, Athena referred to athletes previously as patient athletes. And I think that phrasing is very important, that we recognize that athletes can look very short term. They can be very much about the here and now and about the game at the weekend or the event coming up or the Olympics, and not necessarily look at the long term implications for their health. And as healthcare professionals, we need to have that longer term view for them. We were playing, one of my good friends at home was playing Gaelic football again at quite a low level. It was a social team, but he was hugely invested in it. He was having some ankle issues, and he got the local doctor to give him a number of steroid injections for this ankle issue so he could play in this relatively meaningless game. And now, 10 years down the line, he has two young kids, and playing football with them in the garden is not an option. His ankle is in very, very bad shape as a direct result of this previous treatment. So I think it's given me a good view of the importance of not necessarily looking at the very short term side of it, but also being aware that athletes are humans at the end of it, at the end of the day, and you do need to be cognizant of the fact that there is a life after sport, and you need to look after the patient as well.
Okay, thanks for sharing this experience, because it is really important to know what the athletes are suffering with, or what they live, because it is not easy to be a professional athlete. Lots of issues. Let me check for the chat zone if any question or contribution. By the way, you also shared your contact information, and I think you have an initiative as a personal company. I think this will help. This you are consulting to us directly.
Yeah, so I work mainly in the UK and in Bermuda with sports organizations around their policies and procedures, and occasionally with athletes directly, mainly on the medicines usage review side, to ensure that whatever medication that they're taking is appropriate for use and that they're using it in the best possible.
Because it is mostly asked by all other colleagues. Okay, we agree that sports pharmacy is important, but what are the possibilities to work as a sports pharmacist? Your model is an example, and there are several other models as personal consulting, like personal trainers maybe. But this is exactly and directly to give the best decisions for the athletes to use or not use any medication or supplements. Thank
Yes,
you, Colin,
thank you very
for
much
your
for having me.
great presentation.
Cheers.